I'm Dr. Anadel Barbour, and I'm a licensed marriage and family therapist in a private practice. And I have a trauma-focused practice, and much of it is on, sexual abuse and sexual concerns these days. and I have also worked in treatment centers, most currently Refuge Recovery Center in Los Angeles. Well, the training at Refuge was, in my opinion, the ideal setting to be trained for EMDR trauma therapy, because the trauma therapy has so much need for mindfulness and awareness as part of the resourcing before you even get into the trauma work. And so it was built in at Refuge Recovery. That's where I did my training. And so the clients came in directly into recovery for drug addiction and alcoholism, and people were afraid to do trauma work with people in recovery. They thought that would be too much for them. And here, this meta protocol came in almost built in. And so when I was trained, it was a pretty quick process to see improvement in people rather quickly in the recovery process, and it really helped them to have more tools to stay sober. I don't think I've ever put that into words. I know it viscerally and emotionally and mentally, because I see what happens with my clients. But how it has changed is that when I talk about recovery from traumatic experiences, it gives them so much hope. And they jump in because they feel like it's a more tangible type of therapy. It feels as though they are participating, not just physically, but collaboratively with the therapist in such a way that it's an empowering type of therapy for them. And so that's how it's changed it, because I don't feel so much like an expert as a person that's, working alongside them. So it's just a great experience. Well, there are a couple that come to mind. One that has, she presented with a lifetime of trauma, but her mother had actually murdered her sister. Her sister was a baby, she was 6 years old, and she saw the murder. And we began almost immediately with, because she was in a recovery center and knew meditation and grounding and breathing, we started almost immediately, like 3 sessions in, with reprocessing of that incident. And she reported after the very first session that the charge of that memory had dropped down from a 10 to a 2. And luckily enough, I'm still working with her in my private practice. And she reports that it's at a 0, and she's still sober. She has her own child. She is just living a normal life. It's just astonishing. So that's probably the most incredible story I could bring to this, just so people know how great it works. Well, the benefit really is they immediately begin to get in touch with their own thought processes, their own body. They learn how to connect and redirect and emotionally regulate. And it gives them an ability to go out once they leave to seek some trauma therapy, EMDR, in private places, and like me. Private practices, or to maybe want to stay in recovery at the center longer so they could get more help. it's interesting because being able to participate with the client in mindfulness meditation, whether it's metta or compassion or some breathing exercises, I get to practice it along with them, even if I'm guiding them. And when the client leaves the office, they leave with a sense of ease. And so the mindfulness practice carries on for them when they leave, and it also carries on for me during the day. So it really, really benefits a lot. The team approach was valuable because it was an automatic support system for the client. They had many people to go to, and we all had the same language. And if anyone was confused about something, we knew we could send them somewhere else and they wouldn't be steered wrong. There was no fear in that. So it's just very, very helpful to, a lot of people come in without a support system. Their families have given up on them and everything else. So that's probably the core of working in a clinic, that they already have a support system in place. I do believe that this is the therapy of the future. And as a meta concept, the mindfulness and the trauma work together, because they're a necessity, will become their own form of therapy. I think everyone will want to, or many people will be interested, in other words, in relieving themselves of some suffering. And if they can do it in something that feels tangible for them, that actually talks about the brain and what it does to the brain. People love that stuff. They really love that stuff. With the neuroscience of mindfulness and then the neuroscience of EMDR, people are really just embracing it. Well, what I have found as a private practitioner is that many people need a lot of guidance to resource themselves. And so I have found that it's a really great place to introduce a way for people to feel empowered for the first time in their lives with the meditation, with the awareness, the 4 foundations of mindfulness, and then bringing in heart practices and forgiveness practices just to start with. A lot of people just don't realize that it's that easy to get to know yourself. And then when we move into the trauma work, it's less scary because they feel like they can control the situation. It's in their hands, in other words. So it's in the private practice, there's more grounding than there was in a clinic setting. But it really helps them to leave therapy confidently. My practice has, in this day and age, with the Me Too movement, I have seen a lot of people come in really wanting to get well. They never thought they had a place to come, that they would have to keep it buried inside. So I have a lot of people calling me because of what I specialize in, to really heal from their sexual traumas that have been secrets for years. And so it's just enabling people to live more freely and to have a voice.